Give it a sec. There we go. So thank you. I'd like to introduce Georgia from Merri Health to give this awesome presentation, and I'll let them introduce themselves.
Awesome, thank you, Pen. So yeah, my name's Georgia. I've already done a little intro previously, but I'm the Young Carer Advisor at Merri Health Carer Gateway. I'll tell you a little bit about how all those different words interact in a second. Really excited to be here, especially during, as was mentioned earlier, it is National Carers Week this week. It's actually the 30th anniversary of National Carers Week. So really excited to be here talking a little bit about young carers generally, but also about our program to engage young carers in the work that we do at a service delivery and design level. So as I mentioned earlier in this meeting, I'm dialing in from the land of the Wiradjuri, Woiwurrung and Boonwurrung people, but really excited to be able to share with you today, and really wanted to acknowledge any Aboriginal elders, past, present and emerging, any First Nations people with us today, and especially put an acknowledgement in for the many thousands of years of care that our First Nations people have given this land, as well as the communities and the people of this country as well. Really excited to be able to share that with you here in Carers Week. So before I get into the session, talking a little bit about what we do to engage young carers in our program, I wanted to chat just really quickly about who carers are, who young carers are, and what Carer Gateway is. So as we mentioned, as I popped in the chat earlier, a carer is anyone providing unpaid support to a family member, friend or partner with disability, mental illness, chronic health issue or age-related condition. So that's a pretty huge community. We know a lot of people don't identify with the term carer. And often when we start talking about this, we hear from a lot of people either identifying they themselves were young carers and didn't know, that they have friends who are currently carers or young carers who may not know about that term. And especially for anyone here today who works with people who themselves have disability, mental health challenges, many of those people may have carers at home that they don't identify as being their carer. We know that term can be a little bit problematic, a little bit stigmatized. But importantly, if there is somebody at home who's providing support to someone, that person themselves is eligible for some supports in that caring role. And that's where Carer Gateway can come in. Really importantly, children and young adults aged 25 and under are known as young carers, and that's who we'll be primarily talking about today. So young carers are actually a lot more common than people think. There are around 2 to 3 young carers in every classroom. But young carers have a lot of challenges themselves. Those caring roles can be really, really significant. And many people are not identified as needing support or connected in with supports that are there. Around 2 and 3 young carers themselves have mental ill health conditions, as well as deal with distress from that caring role. Around 50% of young carers live below the poverty line. And we know that caring responsibilities really impact young carers at school and education and in their engagement with employment early on. And that can have some really long-term effects on them as well. That's why we find it really important to identify carers wherever they are and however young they are, so that we can put supports in place for them and make sure that they're on the trajectory to have the life that they want for themselves. So Carer Gateway, the program that I am employed by, is the national program funded by the Australian government. So that's through the Department of Social Services. Here in Victoria, Carer Gateway is delivered by a consortia of health and community organisations, which is led by Merri Health. So we do a lot of the statewide work, so things like carer engagement, our statewide intake team sits with Merri Health, as well as a lot of the behind the scenes stuff that makes the program work. People can connect in with us through our 1-800 number, that's 1-800-422-737, or through carergateway.gov.au, which has some really fantastic resources and information. And importantly, for anyone here who might be working with young carers or know any young carers that they'd like to connect in through their organisations, we do have an e-referral process. This does work here in Victoria. This is something we've set up. It's not a national program, the e-referral. All of the other general information is national, if we've got anyone dialing in from outside of Victoria. But ereferral.carergatewayvictoria.org.au will give you an opportunity to connect somebody in that you might be working with. More importantly, onto our youth participation work. I should have said I only have a fairly short amount of time, so we'll be breezing through this pretty quickly. If you've got any questions, pop them in the chat and I'll try and respond to them after I finish. So Carer Gateway itself was originally co-designed with carers. However, we think there's a real opportunity to embed carer voice more systemically in the work that we do at Merri Health in delivering and improving the program going forward. To make that happen, our team developed a Carer Gateway advisory group, which is for carers of all ages, and a Young Carer Gateway advisory group, which I'll be talking about today. Particularly importantly, we reached out to YACVIC for some support in this program. We'll have a little bit of information about how we've worked with YACVIC to really bring in youth participation expertise in the work with our young carer group. So as I mentioned, we have two groups. So one of those is for young carers, which we work with young carers aged 15 to 25 on that group. We've worked together in our pilot year, really co-developing our processes, even our paperwork with that group, and really letting them set the priorities for what we work on. Throughout the pilot, we've been evaluating fairly consistently. We'll have a formal final evaluation in March next year, and we'll be developing a co-design toolkit by June next year. The groups are statewide, so they connect via Zoom. Mostly we meet monthly, but have been moving to 6 weeks towards the end of this pilot based on our review of how we've been going. Half of the agenda with the group is set by the Merri Health Carer Gateway team, and then half is set by our young consumers. We're really prioritising sharing the learnings that we have with these groups, both within Merri Health and our Carer Gateway consortia across Victoria, as well as groups like this one here today. Really quickly, I'll share some key achievements so far with our young carer group. Aside from a lot of behind the scenes engagement, they've participated in our annual planning for engagement and marketing. They will be the deciding voice in participatory budgeting for our engagement projects in the next couple of months. We've also had a few really fantastic partnership projects, things that have been going on. One's an awareness raising partnership project with Headspace that many of you may know of the Visible project. We have some really exciting work that will be unveiled in the new year on this one. But that's been really fantastic group of young people working on that. At Care Expo in 2022, 2 of our young carers shared their stories about being a young carer. We've delivered a presentation on co-design with our young people at the Public Health Association of Australia's Population Health Congress, and also delivered a presentation on a TikTok campaign, which was conducted through young carers in the Barwon region. We also have an ongoing project, developing young carer practice guidelines. This is an ongoing piece of work that'll be happening over the next couple of months to year or so. This has been really quite systemic work to involve young carer voices in how we really do the service at a practical level. And we also have some peak bodies in the sector involved in that as well, including YACVIC, as mentioned, and Little Dreamers that were mentioned before, and Carers Victoria. Now, for this session today, I really wanted to focus on some of the practical things that we've learned. We will be delivering a more formal project evaluation and toolkit in the new year, but there's some, I guess, small things that have been really valuable for us that we like to share. We've been able to share this throughout Merri Health. It's been really helpful, and many of the groups here may already have youth reference groups established, but if you're looking to set something like this up, hopefully these are some small learnings that you can implement really practically that can help get some things rolling a little bit faster, as it does take a little bit of time to get everything together. So probably the number one learning is seeking expert advice. As I mentioned, we were able to partner with YACVIC A huge shout out goes out to the wonderful Maya from YACVIC, who's been an ongoing support on this project. They've been able to deliver some really tailored training, for one thing, with our young carers, and that's been really fantastic. They've also been able to model the youth participation work and have a youth facilitator who's helped us out throughout our pilot year. I think that's been really beneficial for our young people to really model that work, really see a young person and a young carer taking on those leadership tasks. And over time, our young people have really stepped up into those roles. And I think that really is because of the impact that that expert advice has had for our groups. We've also been able to share opportunities and engagement ideas from YACVIC and our organisation and vice versa, which I think is really helpful for improving some of the cross-sector communication. And that's been really valuable for me personally as somebody facilitating these groups. Remuneration has been a big learning curve for us. We do believe in paying our carer representatives and young carer representatives, but there isn't a lot of standardisation in the sector. I know this is something that YACVIC and the YPPN have some resources about. I really recommend diving deep into those, but probably more specifically, if anyone's looking to set up a remuneration program for consumer representatives, be aware that it can take a bit of time, and it really does help to engage with your HR, your finance teams, accounts payable if you have those separate to finance, and capture that sort of process expertise early on. There may be some considerations in terms of some of the legal and tax implications that it's really important to get advice on early. And especially being able to make sure the information you provide on that is youth friendly when you're sharing those kind of internal resources out then to your young consumers. My slides seem to have frozen, excuse me. There we go. One of our other big learnings has been around the onboarding process. Our young carer representatives received a bit more of an intensive onboarding than our older carers in our general aged group. They had a month of quite regular meetings and additional training, the youth advocacy and youth participation training. We found that more detailed onboarding, while it was a bit more time intensive up front, it was really, really beneficial for the group. And if anyone's looking to do this kind of work, I'd really recommend it. It got a lot of the relationships established quite early. The groups were able to establish that cohesion really well. And a lot of the projects that were able to then be delivered, I think that all happened much faster because the young people had a more supported experience. They felt like they knew each other and they understood things much better. So I really recommend investing that time up front. I also recommend, while we really wanted to make sure that what we were doing with the group was led by the young people, and that has been the case, having some early projects with really clear, visible wins early on, that can be really, really effective as well. If you've got a few things ready to go with your young people, people want to see the impact of their advice. Having a few early wins really helps to generate that momentum with the group, and it establishes that passion and engagement for the long term. So that's also something we would recommend anyone else doing this kind of work. One of the challenges that we've had being in a fairly complex service system, as many of us are, is some of the expectation management with the young people. We found that the young carers are extremely passionate about improving services, often because some of them have had quite difficult experiences themselves. And many of those areas of passion that they want to improve fall outside what we can directly deliver internally at Merri Health Carer Gateway. Being really clear about what we can and can't change has been really helpful for us, but also finding some opportunities potentially outside of what your specific engagement work is. So that might be wider consultations from maybe government departments, other services, other organisations, finding ways that people can share their passion for service improvement in the areas they're interested in, but in a way that is, I guess, manageable for you as a worker or as a team delivering this kind of work. We do find it's really helpful to embed really clear information about what the focus of your participation will be. really early on in any of the communications going out to young people. Another, I guess, big learning for us has been some of the balance between risk and compliance with accessibility for young people. As a health organisation, we do have a lot of risk and safety requirements. Those are really important, especially for our young people. We want to keep them safe. We want to make sure that they are being supported in their environment, especially having some young people who are under 18 and some who are over 18. There's quite a different set of rules for different age groups within our sort of risk factors. But doing some of the paperwork and some of the screening checks and things like that can be really challenging for some young carers, for some young consumers, and those can be quite significant barriers if they're not managed well. Once again, we would really recommend anyone doing this work engage with your HR teams early, see what support is available, whether things can be delivered in a different, maybe a different medium, in a different way. For example, there was some mandatory training that we have to do with all volunteers at Merri Health, but we've been able to have some conversations about whether that can be done in a sort of live group facilitated session rather than each person individually clicking through an internet-based LMS system, which is not as user-friendly for many of them. So we've been able to make some small changes around things like that. One of the other things that we'd note, not specific to young carers, but we will say that our culturally and linguistically diverse carers and our young carers, as well as those in our other group who are over age 65, were the most likely to be adversely impacted by some of these checks and balances that we need to have in place. So being really mindful of how you can meet those diverse needs of wider groups, whether they're language needs, whether they're if people have certain kinds of documentation, or whether people can access certain kinds of technology. Those are really important considerations. And then our final sort of key learning is how we sort of embed the structures to actually get real participation within our groups. As we mentioned, we sort of split the agendas within our groups. Half of that was set by Merri Health Care Gateway and half of it was open to our young people. We've been really fortunate that our young people have really wanted to step up into some of the facilitation roles and leading some of the projects within the group, which is fantastic. We certainly have found that some of the more administrative tasks, which we thought early on they may want to take on to have a sense of ownership over the groups. So for example, writing minutes, things like that, writing the agendas. We found that over time that our young carers weren't as interested in those kind of tasks. They didn't actually equate to meaningful ownership of the group for them. They would prefer to have more participation in the content discussions and things like that, rather than feeling distracted by that admin processes. So having enough staff support that we can deliver that background support and really enable those young people to participate was really important for us. As we mentioned, providing the space for, innovation was really important. We really wanted to be led by the young people as much as we can around what their ideas were on what we should be working on and how we should be doing it. But there is always a balancing act with that in terms of what the realities of our system are, what we can deliver with the resources at hand, and being able to sort of communicate that in a way that is accessible for the young people and still lets them know that we are hearing them and we want to deliver as much as we can based on their feedback, but being as upfront as we can with some of the challenges that we all have as organisations. I don't think any of us feel like we have enough time, enough people for all of the amazing things we'd love to be doing. So those were some of the balancing acts that we really had to manage over the course of engagement with this group. And then I think finally the biggest thing for us really has been embedding support and really culture support from the beginning. We did go through a process of developing some wellbeing plans with our young people. Those have been really beneficial, partly just for them, having a chat with the facilitator in a one-on-one setting, getting to know them, building trust was really valuable. But it also means that we have some information about what's going on for that young person in their real life, in the caring role, so that if they ever needed some additional supports, we've got some plans in place that we can activate that they've agreed to and feel comfortable with as well. That's a very, very quick summary of some of the practical learnings we've found. I'm really excited to be able to share our project evaluation with this group, hopefully early next year. And then we'll also have a co-design toolkit in the around the middle of the year that we'll definitely be able to share with this network. Just to reiterate, if anybody had any questions or wanted to know more, in terms of Carer Gateway supports and supports for any young carers you might be working with. Probably the easiest ways to get in touch are that 1-800 number, 1-800-422-737, heading to the Carer Gateway website, carergateway.gov.au. And if you wanted to know anything more about the youth participation side of things or a general consumer engagement work, I can pop my direct email in the chat. You've probably also got it in the YPPN network notes, but also on the screen we have our Carer Gateway Carer Engagement team email. So that's cgcarerengagement@merrihealth.org.au, and that will get you in touch with our whole team to talk about what we're doing, including if you'd like us to come along to any of your organisations to talk about supports for carers and how you can refer in more detail, we can come along and do that as well. I hope I haven't gone too far over time, but I will hand the microphone back.
Thank you so much, Georgia. I feel like you were just right on time. Beautifully done. You shared so many great things about what you're working on and some great tips. And I feel like everyone's put in the chat how many notes they were taking, just like trying to absorb all the amazing information you gave us. So thank you so much. I'm going to stop the recording there.